Now, biomarker platform. Now, we actually always need a biomarker to select the patient. This is an ideal biomarker. The red guy are the one that respond, and then we use a biomarker to select them, 100%, high sensitivity and specific. That's perfect. But most of the time, we have not so smart biomarker. We want to select the red guy, but we only select part of the red guy, and then we get some yellow guy into it and thought that is the red guy. And as a result, they do not work. The response rate becomes low. So how can we make a smarter biomarker? Now, as you can see, the ADC is a huge market. Then what is the biomarker? Well, of course, we try to target the protein. And that may be the one, because they attack the protein get it into the cell. As a result, it may work. But unfortunately, most of the biomarker, not just looking at the protein, it doesn't work so well. This is another biomarker for HER3, and then the biomarker is totally useless. Now, why is that? Well, one of the reasons is that we are actually looking at things in a different way. Now, first is that how detailed we look into it. But this is actually something new called the quantitative continuous score. They use AI to look at each protein and quantify them inside the cell and outside the cell. As a result, they create a ratio and then identify 75% of patients with this ratio, which is considered to be positive. And based on their randomized study, they were able to identify the fact that, hey, squamous cell, they don't actually have such a good expression. Other cells, they may have actually better expression. So as a result, they were able to demonstrate that the patient with a positive QCS score were able to have a better result compared to a low one. So in a way, is that the next wave of the biomarker is going to be the quantification by AI technology. That's another dimension, is the fact that we actually have always looked in tumor in a two-dimension fashion with a pathological slide. But nowadays, actually in CUHK, we have developed three-dimensional histopathology. So this is actually very interesting in a sense is that because we can look at tumor block, and then we can quantify a three-dimensional tumor block such as I showed you. Now we have actually this technology in CUHK, and which is actually using a special compound. We only disclose part of it to you. It's called cyclodestrine. And then we use the cyclodestrine to bring in the antibody, and in the same time, we can bring in multiple antibody. Just show you one example that what we have done. This is actually a three-dimensional picture of a colon. The red is the vessel, the whitish is the nerve. As you can see that we can actually get a piece of colon and look at the three-dimensional fraction. Now, how does it actually apply to biomarker? Well, what we can do is that this is a tumor tissue. DAPR is actually the neutral one. TROP2 is the one antibody direction. HER3 is another one. So we can actually stain the tumor in a three-dimensional manner. As a result, we can quantify the tumor in a three-dimensional fashion.